Hello everyone, welcome back to the channel. In today's video, we are going to discuss one of the most important and most commonly performed tests in optometric practice, the Ishihara Colour Vision Test. This video is especially useful for optometry students, eye care professionals, and anyone who wants to understand color vision assessment from a clinical perspective. In this video, we will discuss why we test color vision, where color vision testing is required, what the Ishihara test is, which color deficiencies it detects, the exact clinical procedure, different types of plates in the Ishihara 38 plate edition, interpretation of results, advantages and limitations of this test. Before we begin, make sure you watch this video until the end. At the end of this video, I will show you a complete demonstration of the Ishihara 38 plate test. You will see how each plate appears to a person with normal color vision and how the same plate may appear to someone with a color vision deficiency. This practical demonstration will make it much easier to understand the interpretation of the test. So let's get started. Why do we test color vision? Before discussing the Ishihara test, let's first understand why color vision testing is important. Color vision testing is performed for several reasons. The first reason is to detect congenital color vision deficiency. Many people are born with color vision defects and may not realize they have a problem because they have experienced colors differently throughout their lives. The second reason is occupational screening. Many professions require accurate color discrimination, including pilots, air traffic controllers, railway workers, electricians, military personnel, police officers, certain healthcare professionals. Correct color identification is important for safety in these professions. The third reason is diagnosis of ocular and systemic diseases. Acquired color vision changes can occur in conditions such as optic neuritis, optic neuropathy, glaucoma, macular diseases, diabetic retinopathy, neurological disorders. Therefore, color vision testing can provide important clinical information. What is the Ishihara Colour Vision Test? The Ishihara Colour Vision Test was developed by the Japanese ophthalmologist Dr. Shinobu Ishihara in 1917. It is currently the most widely used screening test for detecting congenital red-green color vision deficiencies. The test consists of multiple pseudoisochromatic plates. Pseudoisochromatic means that colors are arranged in such a way that a person with normal color vision can identify a hidden number or pattern. However, a person with color vision deficiency may see a different number or may not see the figure at all. Which color deficiencies does Ishihara detect? The Ishihara test is mainly designed to detect red-green color vision deficiencies. These include Protan defects, which are red deficiencies, protanomaly, protanopia, Deutan defects, which are green deficiencies, deuteranomaly, deuteranopia. The Ishihara test is not designed to detect blue-yellow color defects, also known as Triton defects. For blue-yellow defects or acquired color vision problems, other tests may be required, such as Farnsworth D15 test, Farnsworth-Munsell 100 hue test, City University Color Vision Test. Clinical procedure of Ishihara testing. Now let's discuss the correct clinical procedure. This is very important because incorrect testing conditions can affect the results. Number 1, lighting condition. The test should ideally be performed under natural daylight or standard daylight equivalent illumination. The recommended color temperature is around 6,000 to 6,500 Kelvin. Avoid yellow room lighting, dim light, colored light, direct glare. Good illumination is essential for accurate results. Number 2, testing distance. The Ishihara plates should be held approximately 75 centimeters from the patient, which is about arm's length. The plate should be perpendicular to the patient's line of sight. Avoid tilting the book because it can affect color perception. 3, patient correction. If the patient normally uses near glasses, they should wear their appropriate near correction during the test. 4, monocular or binocular testing. For routine screening, testing is commonly performed binocularly. However, in clinical situations, each eye can also be tested separately. Time per plate. Each plate should be shown for approximately 3 seconds. Do not allow unlimited time because patients may guess the answer. Now let's discuss the different types of plates in the Ishihara 38 plate edition. Understanding the purpose of each plate is more important than just memorizing numbers. Number 1. Demonstration plate. The first plate is called the demonstration plate. This plate can be identified by normal color vision individuals, color deficient individuals. The purpose is to confirm that the patient understands the instructions. If the patient cannot identify this plate, it may be due to poor visual acuity, poor understanding, language problems, lack of cooperation. It does not necessarily indicate color blindness. Number 2, transformation plates. Transformation plates are designed so that a normal observer sees one number. A color deficient observer sees a different number. The figure appears transformed depending on the person's color perception. These plates help detect the presence of color vision deficiency. Number 3, vanishing plates. These are called vanishing plates. In these plates, a person with normal color vision can identify the number. A person with red-green color deficiency cannot see the figure. The number appears to disappear or vanish. These plates are highly useful for screening color vision deficiency. Number 4, hidden digit plates. Hidden digit plates work in the opposite way. A person with normal color vision may not see the hidden figure. However, a person with color vision deficiency may identify it. These plates help confirm a color vision defect. Number 5, diagnostic plates. Diagnostic plates help determine the type of color vision deficiency. They help differentiate between Protan defects, red deficiency, and Deutan defects, green deficiency. These plates provide more information than simple screening. Number 6, tracing plates. The final category is tracing plates. Instead of reading numbers, the patient traces a pathway. These plates are useful for children, illiterate patients, patients unable to identify numbers. The patient can trace using finger, pointer, cotton bud. These plates provide another method of assessing color vision. Interpretation of results. After completing the test, the patient's answers are compared with the interpretation chart provided with the Ishihara book. A person with normal color vision will correctly identify most plates. A person with Protan deficiency will show a pattern suggesting red deficiency. A person with Deutan deficiency will show a pattern suggesting green deficiency. The official interpretation chart should always be used because responses depend on the specific edition. Advantages of Ishihara test. The Ishihara test has many advantages: quick, easy to perform, affordable, reliable for screening, widely used worldwide, excellent for detecting congenital red-green color deficiency. Now, limitations of Ishihara test. However, it also has limitations. It mainly detects red-green deficiencies. It does not properly assess blue-yellow defects. It is not ideal for many acquired color vision disorders. It does not accurately measure the severity of color vision loss. Results also depend on correct lighting and testing technique. Therefore, it should be considered a screening test rather than a complete color vision assessment. Clinical tips. Before performing Ishihara testing, always use proper illumination. Maintain approximately 75 centimeters testing distance. Show each plate for around 3 seconds. Do not guide or influence the patient's answer. Record exactly what the patient reports. Always use the official scoring chart. Had a conclusion. So to summarize, the Ishihara Colour Vision Test is the most commonly used screening test for congenital red-green color vision deficiency. The 38-plate edition contains different categories: demonstration plates, transformation plates, vanishing plates, hidden digit plates, diagnostic plates, tracing plates. Understanding these categories helps optometrists perform and interpret the test correctly. Now, let's move to the practical demonstration. In the next section, you will see the Ishihara plates and how they appear to a normal color vision person compared with someone who has a color vision deficiency.
Plate 1, everyone should see number 12. Plate 2, normal view, 8 red-green deficiency, 3. Plate 3, normal view, 6 red-green deficiency, 5. Plate 4, normal view, 29 red-green deficiency, 70. Plate 5, normal view, 57 red-green deficiency, 35. Plate 6, normal view, 5 red-green deficiency, 2. Plate 7, normal view, 3 red-green deficiency, 5. Plate 8 normal view, 15 red-green deficiency, 17. Plate 9 normal view, 74 red-green deficiency, 21. Plate 10 normal view, 2 red-green deficiency, most people don't see anything or see something wrong. Plate 11 normal view, 6 red-green deficiency, most people don't see anything or see something wrong. Plate 12 normal view, 97 red-green deficiency, most people don't see anything or see something wrong. Plate 13 normal view, 45 red-green deficiency, most people don't see anything or see something wrong. Plate 14 normal view, 5 red-green deficiency, most people don't see anything or see something wrong. Plate 15 normal view, 7 red-green deficiency, most people don't see anything or see something wrong. Plate 16 normal view, 16 red-green deficiency, most people don't see anything or see something wrong. Plate 17 normal view, 73 red-green deficiency, most people don't see anything or see something wrong. Plate 18 normal view, nothing red-green deficiency, 5. Plate 19 normal view, nothing red-green deficiency, 2. Plate 20 normal view, nothing red-green deficiency, 45. Plate 21 normal view, nothing red-green deficiency, 73. Plate 22 normal view, 26 protanopia or protanomaly, 6 deuteranopia or deuteranomally, 2. Plate 23 normal view, 42 protanopia or protanomaly, 2 deuteranopia or deuteranomally, 4. Plate 24 normal view, 35 protanopia or protanomaly, 5 deuteranopia or deuteranomally, 3. Plate 25 normal view, 96 protanopia or protanomaly, 6 deuteranopia or deuteranomally, 9. Plate 26 normal view, purple and red spots protanopia or protanomaly, only the purple line deuteranopia or deuteranomally.